as far as the health sector is concerned, and specifically with COVID-19 and the increase in cases found right there. You can get the details of that on page 12 of your Standards today. Finally, from page of the Star now. COVID surge, hotels to admit patients. Nakuru, Uasin Gishu, Nandi and Trans Nzoia assemblies shut as virus sweeps across the counties. Second wave, the Star asks, alarm as hospitals run out of isolation beds and anxiety levels go up. You can get that story on page 4 and 5 of your Star this morning. And also, even as I talk about that, there's a political story of the day. I'm at peace because of handshake, says Uhuru. And you can see Uhuru right there in Kisumu County yesterday, greeting the citizens of that particular area and the residents of Kisumu, even as they did their BBI and development tour right there. Those are the details of what you can get in your Star this morning. And right across your dailies, that's what you're waking up to right here. But even as we talk about that today, we're keeping a keen eye as far as COVID-19 is concerned. And again, the topic of discussion is COVID-19. Are we preventing or preparing for a second wave? That's where we stand. We have a very eminent panel to take us through this particular discussion and tell us really how do we move forward from here. That's a discussion we're going to be having right here. Welcome to K24 this morning. Okay, let's get right to it. Let me get to my panel first, and then we'll also pose our question of the day to you, because at the end of the day, as we've said with COVID-19, it's all about the personal responsibility you take in terms of making sure you don't spread it, prevent yourself from getting it as well. In studio, joined by Dr. Shamsa Ahmed. She's the head of COVID-19 unit at MP Shah Hospital. Good morning, Dr.
Good morning, Jeff.
Karibu sana, welcome to the show.
Thank you.
It's unfortunate when you walked in, you said the only time you come here, it can only be bad news. I said eventually
we'll move on to better news when we come and talk about vaccines and things. But I think it's important when something comes up, we do need to address it. So thank you for having me. Thank you so much for having time. And I'm hoping there's a silver lining in the grey cloud that we're having right now. We'll be getting into that in just a bit. You also have Gregory Mwaura. He's a counseling psychologist. Good morning, Gregory.
Good morning.
Karibu sana.
Asante.
Because right now, even as you talk about the numbers that you get every day, the behavior is really the crux of the matter. And how do we change that to get people to understand that these are not just facts and figures, these are lives at stake. We'll be having that discussion right here on the show. Also joining us via Skype, joining this conversation virtually, Samuel Kingori. He's a Chief Officer Public Health at Nakuru County. Good morning, Samuel.
Good morning.
Karibu sana, welcome to the show.
Thank you.
Asante sana. Glad you'll be part of this. And of course, you'll be giving us an angle as far as counties are concerned, where they stand, and really how we can deal with it at county level outside of Nairobi County. Let's take this from the beginning, because Dr. Shamsa, the last time you were here, we'd seen, and we were talking about, are we getting to our peak? Are we there yet? Did we get there? Did it dip? Are we back on the second wave? What really happened? Because at some point, even Kenyans got numb to the numbers.
You see, it's also reactionary. When we first saw those images out of China, UK, we all got scared, so we locked down. Even without the government telling us anything, we were ready to lock down. We went into very serious government kind of sanctions, no movements. And then at some point, nothing was happening, so we all kind of relaxed. Then we got into our first wave, which was very significant. And again, we went into those measures and we followed it, and things started to go back down. But unfortunately, with everything, we get tired. It's not just general Kenyans, it's even the healthcare workers, it's everybody dealing with this. There's a chronic fatigue that sets in after a while. And it's true, things did improve. We had very serious numbers, very sick patients around June, July. Coming into August, we also a really nice dip, and we actually breathed a sigh of relief. Most hospitals actually scaled down their COVID units. And we were thinking these measures are working. But of course, once we relax, which we have to open up certain mechanisms, we had to open up the counties, have had to open up work and all of those things, community spread was bound to happen. And when we relax on wearing masks and, relax on sanitizing and get into these, we can have bigger functions and more number of people, this was bound to happen. So from mid-September coming into October, we are back into our second. We are back into our second wave. And you see now, yes, we are prepared, but you do realize most places are de-escalated. Most private hospitals are going back into re-escalating. And even in that, it's not just about having a bed, it's a manpower. We let a lot of people go. A lot of people went back to other jobs beyond COVID. So now it's trying to get all of those structures back into place. So are we preventing or are we prepared? I think we're just somewhere smack in the middle at the moment.
And even as we talk about that, because Gregory, we were saying this before we went live on the show, it almost feels like Kenyans got that initial shock reaction, saw what was happening in China and Italy and Spain, and got so shocked that when it hit landfall, came here, we expected the same number of deaths and casualties. That didn't happen. And now they're numb. Even when you come back and tell them that yesterday we had 1,068 cases, they're like, yeah, those are many, but I'll still continue doing what I need to do.
Yeah, in my world, we say that we are shaped by the environment more than 60%. I.e., how I'll behave is how my environment really instructs us. So when we got those pictures, when we got those, the information from Italy, Spain, we were seeing people dying, and they were really communicating. People, our brothers and sisters who are outside there, they were actually telling us, you guys take precautions. We really went into taking precautions. We adhered to them because it starts from the top. The president gave some directions. We closed some counties, the sessions, and we heed to the instruction. Only that it really begs a lot to really think about ourselves, you know, the kind of direction we are taking. Yes, we didn't have as many casualties as we had. However, that panic, that anxiety, whenever we stay with it for a very long time, the human beings, we have the ability to numb them. Yes, I'm in an environment that is not okay, but I have to tell myself I am okay. It will be okay because I've not been affected. Anybody who has been tested of COVID-19, believe me, they are adhering to the protocols to the letter. However, because others have not really experienced it, that is why even some sectors of our community, of our society, don't believe there is COVID. It's unfortunate that when COVID really came into this country, it came and the interaction up, down is very minimal. However, when the last time I checked the demographics where the numbers are, they're actually within the lower caste of our society. So that is where interactions are more intense. That is where protocols are not really adhered to. So the second wave was bound to happen, and how we will experience it, only God knows, because possibly I cannot really ascertain. Yes, maybe we have a youthful population that our immunities are very okay. However, Dr. can talk more about it. But however, the way we think about our reality, about the environment, it shapes me 60%. The kind of information I'm being given, who gives me this particular information? I think we only, the CS, Mutahikagwe, has been now reduced to somebody giving the information. But when the president calls the nation and really says, this is where we are, I think that is now when we heed to the instruction.
Right. Okay,
yeah.
and we'll be talking about the president and the higher political class in terms of what they're doing. Are they leading from the front in the direction we should be going as far as COVID-19 or not? We'll be coming back to that. But you also have Samuel. He's leading as far as Nakuru County is concerned, Chief Public Health Officer. Samuel, Dr. Shamsa has mentioned the fact that, most, hospitals started to de-escalate. There's some slacking that came in when the numbers started to drop. But even as this was going on, the front health workers had been speaking about the fact that as all of this happens, there are the basic needs that need to be met. In Nakuru County, for example, allowances as far as COVID-19 is concerned, and the contracted medical workers in Nakuru County haven't yet received these allowances. Why is that even now as we get into what could be a second wave?
Okay. Good morning, everyone. Yes, I'm Samuel Kingoli. As you have been told that I'm the Chief Officer Public Health Services in Nakuru. The issue of COVID-19, I want to say that we started experiencing the cases going down in the week of 36, and in the week of 39, the cases we are thinking that it is coming to we are flattening the curve. And now, when it comes to the issue of fighting with this pandemic, I want to say that we as a county, we have put a lot of effort. And first of all, I want to salute all the health workers in the county and in the country at large, and also the other related officers who have been working with the department. And I want to say that when it comes to the issue of health workers' allowances, This is an amount of money that was sent by the national government to the county. That is about 80 million. And this 80 million, it was paid automatically through the IPPD. That is the integrated system which pay the health workers. And may I say that we have the contracted workers who are not captured in the IPPD, and therefore those workers were not captured. But I want to say that already the county is planning to how to pay the workers. It is coming to about 13,680,000, and already we are budgeting for that. So when it comes to the health workers in Nakuru County, we have taken care of them accordingly. Now, when it comes down to the issue of the cases, there is one of the presenters who have said that people have relaxed, and already the health workers have become tired or fatigued by the cases. But I want to say that we had 3 weeks, whereby we are getting very few cases in Nakuru County. And we closed down one of our center so that we can give our health workers a break to go and relax. And they come back later after relaxing. And during that time is the time we realize that there is something that is happening within the community. And we said that can we, as Nakuru County, do what we call targeted testing. And through the targeted testing, that is the time we realize that really there is community transmission of cases within the population. And from that time, the cases have been on increase because of our increase in community targeted testing. Like, for example, the last 24 hours, we have realized more than 137 cases out of 806 samples. Thank you.
And even as we talk about that, as we move it on very quickly, we've spoken about the money in arrears for the allowances being 13 million. Is there a time frame upon which these medical workers should expect to get their money by?
They are going to get the money very soon. We are doing what we call supplementary. You realize that this money was not supposed to, was being given by the national government, but because the health workers were not captured, we are very soon doing what is called supplementary budget, and the county will pay for them. That is, by the end of this month, we are going to do a supplementary budget, and they are going to be paid.
Okay. Even as we move this discussion forward, of course, there's a big question on your role as well, because you can talk about it from a doctor's perspective, bring in the county officials, but you play a role, and that's why we have our question of the day. Let's have it up on screen. What challenges do you have following the Ministry of Health COVID-19 guidelines from where you are, going to work and all that you're doing? What challenges do you have following the Ministry of Health COVID-19 guidelines? You can send us your messages and your feedback on the WhatsApp number at the bottom of the screen. You can also get me at I am Jeff Mote or at K24 TV. So once again, what are the challenges you're facing following the Ministry of Health guidelines? Send us your feedback on the WhatsApp number right there at the bottom of the screen. Even as we move this discussion forward, and you look at page 12 of your standard, they're talking about flouters of virus laws held. Yesterday, at least 100 commuters at Likoni Ferry Channel were arrested for failing to wear face masks. They either lacked them or had worn them inappropriately. Gregory, when we look at this and juxtapose that on the front page of the various dailies, so you have our leaders bringing all these people together, are we apportioning the blame where it really should be? Because yes, we'll arrest these 100 people on the ferry, but you look at a front page where you have the president at the top of his car, throngs of people around him in Kisumu County. Are they the ones who should be arrested and brought to book for this? Because they're the ones who are really talking about, let's have this reggae, let's go out, let's have these rallies happening. Are we apportioning the blame where it should be?
Not really. And also, I'm aware that I live in a country where it all depends on how much you have in your pocket and in terms of your influence for you to adhere to the rules. It is not reason. We are not driven by reason as a society to adhere to this regulation for things that I do. I'm not driven. Is it reasonable enough to do this? We are not informed. We are very behavioral. So, and because I cannot be touched, I'm untouchable, then I can flout the law. Because you can remember a very senior politician within the Nairobi County was actually in a social gathering, and even the police were actually struggling. The many phone calls were made just to arrest the person because he's a bit influential. So that is where we are. So I think for me it has reached a point where it is all about an individual affair. It is all about an individual affair. It's not about our leaders. It's not about whether you're following the protocols. It's about me and my family. I actually challenge, I've been offering psychosocial support to individuals who have tested positive of COVID-19, and some preferred home isolation. And these particular individuals were saying, I realized that I needed to protect my family. Space, some people had space problem, i.e. the resources to actually even self-isolate at home was actually a big problem. Individual isolation was a big problem. So I think for me, I beseech to everyone, it is not about, it has reached a point where I have to be reasonable enough as a person, because especially when I go home, I have a young one. So when I go home, the protocols in our family level, at the family level, are not there. The children will always interact with you. As in, there are people who actually depend on you. It is a high time I summon myself. Our viewers, kindly summon yourself. It is about an individual here and now, because I will not expect leaders to actually make laws to actually protect me. I have what it takes. I'm telling myself I have what it takes. And I have to remind myself each and every day that COVID-19 is actually a reality. I have seen through, thank God I have not lost anyone, around 400, 500 people through psychosocial support. And it is not easy. Okay. It is not easy. When you're told, kindly go for isolation, your family you cannot relate with your family, with the people that you really care for. You cannot relate with them as normal, as you used to be. So I think for me, guys, let's take care of ourselves. It's not about our leaders. It's about me as an individual.
Dr. Shamsa, even as you look at the daily numbers that we get, when it comes to the science of it, what new thing do we know about the virus as of now, as we get into this particular second wave? What should Kenyans be knowing as it moves forward? Because they're like, okay, fine, we shall wear the masks, wash our hands, but what else do we know about this disease?
You see, the sad thing is there's nothing new that's going to change. You see, we had a lot of medications that we were hopeful about.
Right.
Unfortunately, in the last week, we've had a bit of conflicting evidence. WHO came out with a huge study on a specific drug that many countries had been using, and we were hoping that that was going to be the drug that would be the game changer. But they've come up and said these drugs don't do anything. The vaccine is still far away. So unfortunately, it's not going to be as simple as you have high blood pressure here, I've got a tablet for you, you'll be fine. It's exactly what we're saying, it's behavior. And if you look at any disease that has behavior in it, look at HIV, it's 2020. We're running over 30 years of this, and we're still preaching the same messages. As much as we may talk about there's medication for it, but we go back to the same concept of safe practices. So when we're giving you something as simple as a mask, which, okay, again, a mask may be out of the reach for a lot of Kenyans, like we're talking about arresting people on a ferry, whereas the majority of people in Nairobi, if we go through some of our patients, where they've actually come from, like I was telling you, the outbreaks are parties that they were having at home. So maybe those are the populations. I don't think punitive damages is what we need here, and we just have to understand this is a long haul problem. There's nothing like a post-COVID world. It is just something that we're going to have to live with. If you look at the States, they're in their third surge. So this thing of waiting for will it finish completely, it probably never finishes completely. We are all going to get scared again. I promise you in the next 1-2 months, we're all going to panic again. We're all going to go back to wearing masks. We're going to adhere to everything, and the cases will go back down. Even in this concept of testing, you know, we've gone from 60, then there were 400, 600, 1,000. For me, it doesn't even disturb me that much when you tell me there are 1,000. What concerns me is the number of patients who start to show up at the hospital. And now we're not having that, oh, I'm scared, I just want to get a test done. What you're getting is young people who don't have diabetes, don't have hypertension, don't have any other issues, are coming in and they can't breathe. These are people who need oxygen. So the new thing is our patients, which is anecdotal because this is from what we're seeing right now, is that they are younger, they don't have any underlying diseases, which is what we had thought previously was an issue, and they are much, much sicker.
You know, when you talk about that, because like when we had this the first time, it was all about if you have a comorbidity, well, you're highly at risk. Are we talking about a different strain of the virus?
You know,
is that what it is?
You know, the thing is, we have to understand, again, this is a disease in this country for less than 10 months. Right. You know, 5 years from now, when you invite me back for good news, we'll sit and talk about, now we've understood this was the strain, this was that. It is possible we're getting different strains because we opened up our airspaces. Right. If you look at it, previously we thought if you get infected, you can't get infected again. But now we have specific cases abroad where they found someone who had one strain, recovered, tested negative twice, traveled to another country, came back, and now tested positive for a completely different strain, meaning you can pick up a completely different infection, and you can fall sick again. Herd immunity, which you talked about, herd immunity should come with vaccinations. Herd immunity should not come with let's sacrifice the population and let's mingle around and hope that some people will be able to do better than others. You know, I find it really sad, you know, when we sit and we say, oh, I don't know anybody with COVID. It is it has no compassion for the families that have lost relatives to COVID. I mean, when you read numbers of 800, what is 800, what is 50? Right. But an individual to a family is devastating. It is very dehumanizing to be in isolation, whether you're isolating at home or if you go into any hospital with any infection currently, you'll have to be isolated while we're trying to figure out if it's COVID or not. Those 24, 48 hours, being locked in a room, not being able to talk to anyone, the uncertainty of knowing, will I get COVID, will I recover, it is extremely dehumanizing. It's very disrespectful to the healthcare workers who are working really, really hard and risking their lives daily for people to say it doesn't exist. It exists. I'm really happy that many people haven't fallen sick. Okay. Yeah, but it exists, it is there, and if it gets you, we won't be able to tell if you're the person who's just going to go home on some vitamin C that makes you happy, or we're going to end up in ICU. Okay.
Before we get to our break, I want to bring Samuel back in on this one. From where you stand, Samuel, what's the biggest challenge the county of Nakuru is facing in terms of dealing with this particular pandemic as well?
Okay, one of the challenges that we as the county government that we are facing when it comes to this issue of COVID-19 is one is the issue of the community. When it comes to the enforcement of COVID-19 guidelines, one, the people are already hostile with this issue of COVID-19 regulation. Already the community is becoming what we call fatigued, and there is also the denial that there is no COVID-19. People are saying that there is no COVID, and therefore they don't believe that there is need for them to wear a mask, to keep the social distance, and also to observe the guidance from the Ministry of Health. And therefore, when you go we are doing what we call risk communication. You go to a targeted community. What they are asking you, have you ever seen somebody suffering from the COVID-19? They want to see somebody who is suffering from COVID-19 so that they can believe that there is COVID-19. And that is one of the biggest challenges that we are having. The other issue is about this issue of social gatherings. People are not still observing this issue of social distancing. When you go to bars, for example, in those social areas, people, they take one or two beers, and then they say that they have already sanitized their system, and therefore they cannot get COVID-19. And therefore, what they do, they throw the mask, and they start socializing within those areas. And this has become a big issue. When you walk in the streets of Nakuru, and even in other states in this country, you'll find that it's only less than 25% of the population that are wearing the mask the way they are supposed to be worn. And therefore, you find that more than 75% of the people, they have the mask, but they are not properly wearing this mask. Okay, Samuel, so when it comes to this issue of enforcement, it becomes a big issue.
Okay, Samuel, I want us to take a break at that particular point. Of course, even as we come back after the break, we want to know what the challenges you're facing as far as following the Ministry of Health COVID-19 guidelines are concerned, because really that is the difference in terms of you getting it or not getting it. So please send us your feedback on the WhatsApp number at the bottom of the screen. If you haven't gotten yourself a copy of your People Daily, the number that you dial is *550 *4#. You get it straight to your phone. It's brought to you by the People Daily and Safaricom. Back in a bit. This is K24 This Morning.